People have been pursuing medicine outside of India. So when they come back to India, what kind of tests do they have to take? What kind of exams to pursue further education?
First, they have to appear for eligibility test
Okay.
for foreign graduates. For them, they have to appear for, they have to clear that examination.
Only one test would be
Only
there.
one test, that is called eligibility test.
Are they teaching these robotic surgeries and everything in the
Yeah.
colleges?
They are introducing this
Robotic.
robotics and the importance of artificial intelligence in surgery, in neurosurgery. And slowly the trend is changing. Training in neurosurgery now, the curriculum has been changed.
Welcome to another episode of Metasphere podcast series from MetaFolks Technologies. This is Sri Lakshmi here. Today we have Dr. T.V. Srinivas, super specialized neurosurgeon from Hyderabad. He is a great human being, neurosurgeon, specialized professor, and IMA City Branch President. Today we are going to have deep discussion on career in medicine and specialized in neurosurgery and the subspecialties of neurosurgery. We are going to talk in detail. Please join us. We are so glad to bring you to the podcast series of Metasphere from MetaFolks Technologies. Thank you for coming in. Uh, so, can you please tell us more about your journey as a neurosurgeon? How did it start?
After my MBBS, I joined in MS General Surgery. This is of 3 years course. So what we have is in the second year of our training in general surgery, we had peripheral postings. That means postings in neurosurgery, orthopedics, CT surgery, urology, like that. So naturally, the posting in neurosurgery was there for about 2 months. This was in NIMS.
NIMS Hyderabad.
NIMS Hyderabad, yeah. So at that time, the professor and HOD was Dr. S. Balaparameshwar Rao garu, a very great man. You must have heard of him. So I was posted under him. So usually his work starts at 8 o'clock in the morning.
Oh.
So 8 to 9 class, from 9 o'clock onwards, usual surgeries or OPs, whatever it may be. It used to be last till about 4 p.m. One day, I went 5 minutes late. So he was very angry, I know. So after the class is over, he called me to his room and took me about a class for about half an hour. He bluntly said, "You are not fit to become a surgeon at all because you are not in time punctuality." Okay, and I kept quiet because he is a professor. The posting was over. Last day of my posting, I went to his room and little gathering courage.
Okay.
I told him, "Sir, I want to become a neurosurgeon." So he kept quiet and he told to come to his house
Okay.
next Sunday morning.
Okay.
So I went to his house Sunday morning. He has shown all his work when he was a neurosurgeon in his formative years.
Oh, okay.
So how he started the department of neurosurgery in Vizag.
Okay.
And he showed me the first X-ray he has taken for his first patient.
Wow.
So he kept as a treasure.
Okay.
So that shows how much he is interested in this specialty. That shows, isn't it?
Yes.
So he has shown all his work, the struggles he has faced, and antagonism faced by his colleagues also. He told how people will pull your leg if you are becoming popular, successful, whatever it is.
Okay. Okay.
So after 1.5 2 hours, so lunchtime, there was lunchtime, and we had lunch. And lastly, he asked, "Still, if you want to become a neurosurgeon," like just he said, "Okay."
Okay.
So that made me to decide to become a neurosurgeon. Yeah.
Oh. So, how did you choose medicine as a career after your schooling? Can you tell me?
Yeah. In this aspect, I want to tell you, my elder brother was instrumental in this. So there was no doctor in our family at that time. So he wanted one of us to become a doctor. So he told me to join MPC stream. It was PUC then.
Okay.
Yeah, last batch of PUC.
Okay.
So I joined.
Which year was that?
It was 1971.
71. Okay.
So I joined Nizam's College, PUC. So by PC stream.
Okay.
So because we happened to come from Telugu medium, the English medium to cope up with the initially to cope up was little difficult for us.
Okay.
To adjust to the that lectures and etc. And initially we fared very badly in the monthly tests.
Okay.
So one of our lecturers, Dr. Iyengar, he was PhD in physics. He called us one or two Telugu medium students. Okay. And he made us to sit after the class. And he taught us how to prepare for the exams. Don't get worried. And a moral boosting so that we will not get depressed. So we prepared according to his advice. And afterwards in PUC, at that time it was only optional marks to select for admission for MBBS. So by PUC, physics, biology, zoology, these three subjects. Okay. So these three subjects I topped in the Nizam College. So it was 77%, something like that. So almost top in the optionals. Okay. Yeah. So I was very sure of the seat. So happy. Okay. At that time, and first entrance examination has started.
Oh, you were the first founding batch.
First batch to appear for the entrance for the MBBS admissions. MBBS. Okay. Again problem. See, I was very happy that I could get a seat because of my marks in PUC. Okay. Again preparation for the entrance. At that time, they did not give any model paper, nothing like. They simply said entrance examination. Oh. What type of examination? Is it multiple choice, essay type? Nobody knows. Okay. And fortunately, it was only essay type and just like our PUC exam. Okay, okay. Was it like complicated than your PUC exam? No. It was not at all complicated. Okay. Almost it's just like PUC examination. Only thing was in PUC we had a choice. Out of 10, we should answer only 6 questions. Here no choice. Oh. So you have to answer all the questions. Okay. That was the only difference. Okay. So fortunately we fared well and got selected. Joined in Usmania Medical College, MBBS. And my rank was 63 then, state rank. How many people did attempt? At that time only 22,000 or something. 22,000. 20 or 25,000. Not like this lakhs. Oh, no. Okay. So we joined in MBBS. It was 6.5 years course then. 6.5 years? Yeah. Okay. First year, again, it was not medical subjects. Again, physics, chemistry, English. Oh. English was there at that time. Okay. English, physics, chemistry, botany, zoology. Again, just like same thing like the PUC. PUC. And one more thing, in first year, they used to give importance to the English. If somebody fails in English, they were not promoted. Again, they have to appear for the... Okay. Okay. So how long is this journey to actually start your career as a doctor? See, this is 6.5 years course MBBS. Afterwards, 3 years MS General Surgery. And afterwards, 3 years MCH Neurosurgery. So almost 12 to 13 years of education to become a neurosurgeon. Okay. In between, what happens is 6 months to 1 year, there used to be gap for MBBS to join MS because of the delay in the entrance examination and delay in the results. So under 1.5 years extra we can take, even though we passed regularly. Okay. Is it the same kind of journey that the current students are facing? I mean, having the similar kind of tenure? Yeah, exactly similar. But for the first year MBBS is not there. Directly now it is only 5.5 years course. 5.5. 4.5 years is subjects, 1 year is internship. For us, it was 5.5 years plus 1 year. Okay. So nowadays the students are saving 1 year that first year of our MBBS, what we have studied. Okay, okay. So you also worked as a professor in Osmania University, right? Medical College. Medical College. So how long did you work as a professor? It was about 13 years.
13 years.
Yeah.
So when did you last stop teaching?
See, I retired in 2012.
Okay.
From that time onwards, see, previous to that, it was a very hectic life in Usmania. So after that, little the work part is reduced. Of course, teaching is also reduced. So only practice-wise, we used to spend time more like that. But even though teaching is reduced, what we do is we always attend the conferences. We always attend the workshops, and see, we have to update the things. No, we should not lose our touch with the subject.
Yes.
That is the reason. Even now, I attend the conferences, so we discuss the cases like that.
Okay. So, as we were talking, you taught for students in the current times also. Did you ever feel that there is a difference in the consciousness in students about the career, medical career?
Nowadays, students are definitely they are specialty oriented. Even in MBBS itself, they have decided to become so and so.
Okay.
It was not like that for us.
Okay.
See, only after MBBS, after seeing that role model people.
Okay.
But nowadays, the people, the
Okay.
exposure is very wide,
I
and
know.
they are seeing the society, how society is, how competitive it is.
Yes.
That's why definitely there is a change in the younger generation. Yeah,
Okay.
definitely we could perceive the change.
Okay. Is it based on the opportunity that they would get based on the marks or score that they would choose specialization, or do people re-attempt for getting their own interest?
Exactly. See, actually, the specialty must be by choice, not by chance. Okay, then only you can enjoy the profession, enjoy
Okay.
your specialty.
Okay. For example, like somebody is willing to become a neurosurgeon, but because of the exam score that they have got and all, if they tend to become orthopedics or other specialities, I mean, have you encountered any of your colleagues or such students that they tend to go to this stream but they went to other stream, and then what kind of difficulties would they face?
See, unwillingly to join the specialty is detrimental. But see, somebody wants to become a specialist. Somebody could not get the subject of his choice,
Yes.
joined some other subject, but he should start loving that subject. Then only he'll be successful.
Yes, yes.
Yeah, that should be there.
Because it's more related with humans, right?
Yes, exactly.
That's
And there are some instances of my friends. Initially they wanted to go to surgical field, but they could not go. They went to medical field, but they have excelled.
okay.
See, they should change their attitude. See, this is now I joined this specialty, so I must do justice.
Yes.
So complete dedication, commitment to that specialty, definitely they become successful. Yeah.
People have been pursuing medicine outside of India.
Okay.
So, on graduation. So, when they come back to India, what kind of tests do they have to take? What kind of exams to pursue further education?
At first, they have to appear for eligibility test
Okay.
for foreign graduates.
Okay.
For them, they have to appear for. They have to clear that examination. After that, if they pass that examination, they are just like any other student and from India.
Okay, only one test would be
Only
there.
one test, that is called eligibility test.
Okay. After that, they can pursue other master courses in that?
Yeah, just like they have to appear for the entrance for MS. They have to appear for the MCH if they want to go for super specialty. So same like any other student from the any other government college or private college in India.
India.
Yeah.
And if somebody wants to pursue master education outside of India, so what is the process?
See, usually people go to US and UK to pursue this post graduation. But nowadays in India also there are equal standards are there. We need not go to US or UK for the specialization nowadays.
Okay.
Yeah.
Um, and when we talk about specializations, people take internships, right? How long is the internship?
1 year.
1 year of internship. So, after pursuing medicine, people will get into their doctor profession. If somebody would like to get into research, so what is the way?
See, the people who want to go for research usually there NIN you must have heard of, you know.
Uh,
So NIN is there in Delhi. All India Institute of Medical Sciences is there,
okay.
where they focus more on research and purely research.
Purely
Uh,
research.
and they don't see the patients, and they don't come to this stream, practical stream, and they should devote the entire time for that research. So this neuro research in India, we have in NIMHANS Bangalore, purely research,
Okay.
and in Delhi in AMS and in NIN.
What kind of research work will go on?
See, this research on neuro related, initially a lot of research going on in the experimental animals.
Okay.
Uh, First, they do research on experimental animals, and after becoming successful in that field, and they give the trials on the humans. The safety, they take all the safety measures. Then they do trials on the humans like that.
Okay.
Mm.
So, what kind of research might have went through the phase of COVID?
See, in the phase of COVID, not only medication, the research has been extensively done in the case of vaccine preparation.
Mm.
So there are about 5 to 6 types of vaccines. So this research was so extensive, which vaccine will be more safer, more effective, and patient friendly.
Mm.
So that research has gone, and in that aspect, our Indian counterparts, this Biological Advance and Serum Institute of India, they did a commendable job to produce vaccines in COVID period.
Did you see any difference uh, before COVID and after COVID, especially in the medical space?
Difference is not much.
Okay.
Mm.
You're not seeing any major difference.
Do you mean to say this a treatment part or in the
In terms of being prepared for the worst, in terms of how do you encounter pandemic, in terms of the mindset of doctors?
yeah. See, they have become more protective,
Mm,
because they have seen the tide is now,
I know.
and even simple problem is there, and they are treating in a more advanced way.
Okay.
See, uh, previously, suppose simple cold is there. Previously, they never should take so much care.
Mm,
Now they are taking so much care themselves and also to the patients.
okay.
So we don't know what happens if we think simple cold, but it may turn out to be a little severe one.
Okay.
And definitely the treatment protocols have changed.
Okay.
Treatment protocols of the diseases have changed, because what happened is after recovering from COVID also,
Hmm.
the patients have faced a lot of complications and problems. That made us to think to prevent these complications whenever the patient has some problems. Yeah.
Um, are those implications there on neuro also?
Yeah.
On mind?
Yeah. Neuro also post COVID patients, definitely the incidence of neuro problems are little more in the post-COVID
They're
patients.
spiked up.
Post-COVID patients, that vulnerability is more.
Okay.
Vulnerability is more for those post-COVID patients. Yeah.
What kind of patients have you treated, especially people who got affected with COVID?
Yeah.
What kind of neuro problems have come, and did you encounter any special situation?
Yeah. See, the patients came with extreme weakness,
Mm.
not able to work, even though they have recovered from the COVID, and investigations have shown all normal.
Mm.
So there is no specific cause for the problem.
Okay.
So when we took history, almost more than 80 to 90% of the patients, They had COVID, recovered totally after a gap of 5 months, 6 months, or 1 year, and they had this problem of weakness, not able to work, and sometimes decreased efficiency to work.
Okay.
So all these symptoms they definitely we have seen, and the post-COVID problems we have seen more in the cardiac wise,
Okay.
heart-related conditions.
Heart related.
They definitely had more incidence of cardiac problems.
Okay.
These post-COVID patients. Yeah.
So not on the brain or mind.
Maybe sometimes in the brain also it gets up. See, our body's total body. If one part is affected, other part also can be affected.
Usually, how do you get connected with multiple specialized doctors? Because if a patient comes in, everything is connected.
I know. Yeah.
Especially your neuro system is connected to multiple body areas. So how do you get connected with multiple specialty doctors to treat a patient?
Yeah, we see patient as a whole.
Mm.
See, patient comes to us with some neuro problem, and on examination, suppose we find some other problem also the patient is facing. See, we definitely interact with the concerned specialists
Mm.
to examine thoroughly any problem is there, and definitely we interact with all the specialties. Suppose if the patient is diabetic,
Mm.
we definitely take the opinion of endocrinologist.
Mm.
If the patient is having hypertension, and we definitely take the opinion of the cardiologist.
Okay.
Like that.
Okay.
It is a collective. See, ultimately, the patient safety is more important, isn't it? So
Correct.
that's why we never take chances uh, to treat the patient like that. Yeah.
Okay. Though you understand that definitely there might be problem in other specialized
Yes.
area, but you don't take a call, or will you? I mean, if he has high diabetic, so you don't take a call without consulting the
Yeah.
endocrinologist.
Yeah. Suppose if the patient comes to us as with some neuro problem, I'll tell you, he is diabetic and hypertension. First, we tell them to control the diabetes, control the hypertension, then simultaneously treat the neuro condition.
Mm-hmm.
So we tell them to consult positively for endocrinologist.
Okay.
So this is very important because even though we if we treat only this neuro problem and the diabetes is not controlled, he will not have relief.
Okay.
So it is a collective treatment. Yeah.
Okay. So what we actually see is these the regular vitals, so-called your diabetes and your BP, blood pressure, all these are the major causes of multiple problems in the human body.
Yes. Because diabetes affects all parts of the body, kidneys, heart, brain, and BP also. BP mainly affects the heart and brain also. So to control those problems is very, very crucial.
Okay. So what is a crucial or complicated case that you might have handled when it comes to brain surgery?
Not one. We came
You
across
might have seen
many complicated cases, and we had problems. And see, whenever a complicated case comes, we don't hesitate to discuss with our colleagues.
Okay.
So, see, after examining the patient, we find some problem is there, and I have my opinion of the treatment protocol, isn't it?
Okay.
Suppose if I have doubt, I consult my colleagues, whoever is little more expert
Okay.
in that specialty.
Okay.
See, this is the case. This is what I am going to do, and anything you want to suggest like that.
Okay.
So we never hesitate to take the opinion, to take the.
So that networking is really important.
Yes, exactly. Very, very important.
Okay.
See, among all the neurosurgeons, all are neurosurgeons, but somebody does some surgery, is specialized in that particular single surgery.
Okay. What can be those specialities in brain surgery?
Yeah. See, is a subspecialties is called. See, one is called skull-based surgeries. One is called vascular surgeries.
Mm.
So somebody gets trained in the vascular surgery of neurosurgery.
Okay.
So he will be more perfect in this type of surgeries.
Okay.
So he will be he will doing all the surgeries that, but he will be more concentrating on this type of subspecialty, so that he will become more expert in this specialty.
What is your subspecialty?
I am a general neurosurgeon. I was a general neurosurgeon. See,
Okay.
yeah.
Okay.
When we did neurosurgery,
Mm.
these subspecialties are not developed,
Okay.
and moreover, I was in government service,
Mm.
so I had to do everything.
Okay.
So at that time, but nowadays there are a lot of diversions on there, whereas subspecialties are there. So basically, I was a general neurosurgeon. I am now, even now also I am a general neurosurgeon.
Okay. Okay. I mean,
But now I advocate they should go for some subspecialty.
subspecialty.
They have to go. They have to go in
Okay.
whichever depending upon their interest.
Okay. Okay.
Yeah.
Okay. So you were saying like skull-based surgery. What kind of impact will the patient have when they undergo that skull-based surgery? Anything related to memory? Anything related to change in the personality of a person?
So the skull base surgery means the base of the skull. Some tumors are in the base of the skull, isn't it? So the approach to that type of problems is different.
Mm.
And regarding memories, etc., any neurosurgery, and most of now it is have become more safer.
Mm.
But any neurosurgery, especially brain tumors
Mm.
and uh, these stroke patients,
Mm-hmm.
and definitely they have some problem with memory problems and paralytic problems, and the problem is there, and only for few patients.
Okay. So post surgery and pre surgery, there might be change in the person because it's impacting the brain, right?
Yeah.
At certain point of time.
Yeah.
So what kind of changes would they actually see?
See, brain is such a complicated thing, and small even small problem also cause major effect in the body.
Yes.
Yes, isn't it? So even though we take a lot of precautions during surgery to do safe surgery, and some patients will have some deficits, that is paralysis of on one side of the body, it is called hemiplegia, and some memory problems, especially when we operate on the left side of the brain.
Mm.
These problems are uh, lo- dif- difficulties in the memory, and paralysis on the other side of the body. They do happen, and we will counsel the patient even before surgery.
Even the family.
Even the family attendants also.
Okay.
See, in spite of the best efforts, these things may happen,
Okay.
and some people accept, some people don't accept. If they don't accept, we don't.
But there might be complicated cases where you have to
Ah,
do the
take
surgery.
yeah, exactly.
And do the surgery.
Yeah,
And then but there might be different personality that might come after the surgery, right?
yeah.
They might lose memory.
Lose memory. Some people they become aggressive. Some people they get depressed.
Is it?
Yes. Some people they
Okay.
become aggressive also. Some people get depressed.
And that changes for their rest of the life?
No. See, what gradually the intensity is decreased,
Mm.
but some people will have permanent effects.
So, from the time you have actually started your full-time doctor profession, there are a lot of advancements which came in, right?
Yes.
Maybe from the technology perspective, maybe from the, as you said, subspecialties are there and all. How did you learn? How do you pick up that skill? And do somebody has to approve? How these things? Are there any certifications for this? So, can you please explain?
See, when we were trained in Usmania, and infrastructures were not that good.
Mm.
So I'll tell you one thing, and we did not have a microscope at that time in Usmania.
Okay.
So we had to go to Nimhans, Bangalore,
Okay.
to get training microscope under microscope.
Okay.
So we went to Nimhans, Bangalore. You must be knowing.
Yes.
Yeah, for 3 months. There we got trained and came back to Usmania,
Mm-hmm.
and we purchased microscope
Mm-hmm.
like that. Yeah, and there are a lot of advancements. See, and after one endoscopic surgery is there,
Mm-hmm.
and gamma knife surgery is there, and all this slowly, and the advancement was so much. Now the advancement is so much, and one single person cannot learn all those things.
Okay. Okay. How did you upskill yourself with these kind of technologies? I mean, um, do you have to enroll somewhere?
See, one we have one neurological society of India.
Mm-hmm.
This association, our neurosurgeons association, this association conducts workshops
Mm-hmm.
and hands-on experience
Okay.
and conferences,
Okay.
and these subspecialties also conduct workshops and conferences.
Mm-hmm.
So whoever, depending upon our interest, one can enroll in that workshops.
Mm-hmm.
They can get themselves trained, and those who are the experts on that field,
Mm-hmm.
they will train you.
And you, are there any important certifications that are currently there
Yeah,
in the medical
fellowships are,
space?
fellowships are there,
Okay.
and some fellowships are for 1 year, some
Mm-hmm.
fellowships are for 2 years,
Mm-hmm.
like that. There are there now. The trend is just like in America
Mm-hmm.
and UK, almost on par with all these standards of America and UK.
Okay. And what kind of advancements are there in terms of medical technology,
Yeah.
be it robotic surgeries? Then how are things now, especially in the neuro space, or it could be in the regular medical space?
See, the latest advancement in robotic, the role of robotics in neurosurgery is really, it is enormous. It is like a game changer.
Mm-hmm.
See, the pre-op evaluation time is reduced, the precision is there, and patient safety is more.
Mm-hmm.
And you imagine we are in the operation room, and this will tell us, and along with artificial intelligence,
Mm-hmm.
all these things, uh, it will tell you how much normal brain to cut to see the tumor, to
Oh,
remove the tumor,
okay.
and how much it should be safety point of view, mainly patient safety point of view,
Okay.
with minimal damage to the normal brain or without damaging normal brain, it will tell you. So
Okay.
literally it is a game changer in the field of neurosurgery.
Are they teaching these robotic surgeries and everything in the
Yeah, yeah.
colleges in post
Uh,
graduation?
yes, nowadays all colleges, yeah, definitely they're introducing this
Robotic.
robotics and the importance of artificial intelligence in surgery, in neurosurgery,
Mm.
and slowly the trend is changing.
Okay.
Uh, Training in neurosurgery now, the curriculum has been changed.
Okay.
So to introduce these things,
Okay. Do you see that? I mean, are the errors in the surgeries, because usually we hear such stories, right? So will they minimize?
yeah, yeah,
Okay.
definitely they minimize the errors of the surgery. Definitely.
Mm-hmm. Okay. So do you see any challenges for the doctors from your period of time um, accepting the new technology? Will it take time for you to adapt to that
Yes.
technology?
See, in younger ages, it is very easy to adopt the new techniques.
Hmm.
But in old age, it is not that easy.
Hmm.
Definitely, you are right. In old age, it is definitely to adopt the new technology is not that easy for older people.
So, I mean, how did you encounter? How did you learn? Or how do your colleagues cope up with? What kind of stories do they share?
See, the discussion, like any difficult cases and failures, how they learn from their failures. See, even though we do to the best of our capacity, sometimes we face the problem.
Hmm.
See, that when we discuss what could have been done, what could have been, what more could have been done, what could have been the safety measures, isn't it? So we definitely share along the discussion platforms.
So, what kind of networking events usually we do have for doctors, where a lot of workshops would be conducted, a lot of learning is being shared? What kind of conferences or workshops would be held in India?
See, almost every month one workshop will be there. Workshop on spinal surgeries, workshop on skull-based surgeries, workshops on neurovascular surgeries. Almost once in a month in all the metropolitan cities.
Mm-hmm.
And now there is a lot of chance for younger people to learn. See, they should enroll it, and it's only for limited first come first service like that.
Okay.
And to focus on the students, they take only 10 students,
Okay.
only 10 people.
Okay.
Not only trainees but also younger neurosurgeons also they go for training.
Okay.
So in this way they update.
Mm-hmm.
And also conferences is didactic lectures will be there. See, the senior neurosurgeons or juniors also they present the cases. See, of their experience. See what this my initial experience of these two cases like that.
Okay.
My initial experiences with this problem. So they will present, and seniors will be there. So they discuss. You could have done this. You could have done this like this. Yeah.
Okay.
Yeah. It was a very very interesting discussion goes on. It is a healthy discussion, of course.
Okay. Do they come up with any such new cases where it will be new for you? You haven't heard such cases in your experience.
Yeah. See, in the lifetime, some cases are there. In the lifetime of neurosurgeon, only 2 or 3 cases they have seen. They're very rare cases. So if that rare case is there, we present in the conferences. So we ask them, any of you have seen this type of case, and what was the outcome? See, I did this. My protocol treatment was this thing. Do you suggest any other better treatment for the safety of the patient?
Okay.
Like that.
Okay. Did you ever present any of your complicated case?
Yeah, and not complicated. And my initial I used to present in the conferences, but for the past this 5 to 6 years, I am slowing down.
Okay. Okay.
Like that. Yeah.
So, in anatomy, you usually dissect the body. When it comes to neuro, the brain, how do you actually do? When do you start training, especially on the brain?
In our training in neurosurgery, what we do is again we get the specimen of the brain from the Department of Anatomy.
Okay.
And we request our anatomy professor to preserve
Okay.
that brain specimen, and we
Okay.
get them. Again, we dissect all parts of the brain and all nerves, arteries, relation to other parts. So we have to have that three-dimensional figure, three-dimensional idea.
Okay.
Then only further in the life surgery it will be helpful.
Okay.
But nowadays there are so many these 3D pictures are available and 3D animations are available. Now it is much easier.
Okay.
Nowadays the training has become little more easier.
Okay. I mean that 3D models are also available to such a minute
Yeah.
extent.
Yes.
Okay.
Nowadays because of this advancement technology,
Okay.
it is available and simulate the actual things.
Actual things
Yeah.
to very very micro level.
Macro level. Yeah.
Okay. So how does your day look like on each day, on a regular day, as a neurosurgeon?
Yeah. See, most of my career was in government hospital. So our day starts at 8 o'clock. 8 o'clock we go to the hospital. We do the ICU rounds, and 9 o'clock we start the surgeries. By the time surgeries are over, it's about sometimes 2, 3, sometimes 4.
What is the longest surgery duration?
Oh, yeah. See, we have had a couple of cases, some tumors, mainly brain tumors. We operated about 12 hours.
Is it continuous?
Yeah, continuous. And in between, suppose if we get tired for about half an hour or so, we take rest, and other team member will take care those things.
Okay.
Yeah,
Okay.
like that.
Okay.
We have a couple of cases. Smart started in the morning 9 o'clock. We thought the surgery will be over within 4 or 5 hours, but it went on for about 10, 12 hours. So it does happen sometimes like that.
Okay.
Mm.
So it's a very hectic schedule, and especially brain surgeons are like very. It's a tough cases,
Yeah,
right?
yeah, tough case,
When
yeah.
you compare to most of the other specialization, how do you balance your work, family life, and all that?
See, we should not take hospital things to the house. We should leave those things in the hospital itself.
Okay.
We should compartmentalize, isn't it?
Mm-hmm.
And that way we can balance. And see, this balancing part, we should appreciate. I should appreciate my wife, isn't
Okay.
it? She has tolerated me. I should say, she tolerated me all my whims and fancies.
Okay.
Hats off to her.
Okay. So here, usually from the time it's a very hectic schedule, and you have experienced different variations, different patients, you encounter them. So, as a person, how did you evolve, becoming such a very great neurosurgeon from starting from your doctor profession?
See, we have seen so many cases. Some cases I will tell you. I will tell one regarding one case of my experience. I was a duty neurosurgeon in Usmania, and police people, they brought one case as unknown case. Some accident occurred. So young boy,
Mm.
20 years old boy, he was unconscious. At that time, we did not have a scan in Usmania,
Oh,
so we needed a scan. So in front of our hospital, one private scan was there.
okay.
So no attendant was there. What to do? Immediately he needs a scan. So I phoned to my RMO, resident medical officer. See, this is the case. I want a scan. So what shall we do?
Mm.
Who will pay for that? You know?
Okay.
So in front of our hospital, one private scan, I phoned him. This is a poor case. You have to do it freely. That fellow obliged.
Mm.
Free scan was done because of our goodwill.
Mm.
So there was a clot in the brain.
Mm.
We had to operate. So who will give consent?
Mm.
Somebody should give consent. Nobody is there. We had
Correct.
to operate. Again, I called RMO. You
Mm.
have to give consent for this.
Okay.
No, that is responsibility of the RMOs.
Okay.
If nobody is there, they are authorized legally.
Okay.
In the case of emergency, they can authorize to do surgeries, to
Give consent.
consent.
Okay.
So he gave the consent. So I operated. It was a little serious case only. So recovery wise, I was a little doubtful whether he will recover or not, like that. And it went on for about 3 to 4 hours operation. About 4 o'clock or 5 o'clock in the morning, we finished our operation. So the patient was becoming normal.
Mm-hmm.
So when we went for rounds to see the patient, one lady was sitting by the side, his mother.
Okay.
So I told the mother, the patient is very serious. He may or may not survive.
Okay.
So she wept as usual, no mother, no. She
Mm.
wept. And fortunately, within 7 days, he became okay.
Mm-hmm.
He went walking,
Oh.
and when he came for visit for next time, that mother, she brought one fruit
Okay.
and she gave it to us, saying that this is our from backyard
Farm.
tree farm,
Okay.
something like that.
Okay.
So that was a real incident that made us to think the priorities in the life,
Mm.
isn't it? And
Correct.
our attitude towards the life.
Correct.
Definitely, there is these incidents make us to rethink our life's activities, whatever it is.
Correct.
Yeah, yeah,
Correct. Very nice.
yeah.
Very nice. Good. So
Yeah.
you might encounter such cases on and off.
Yeah, yeah.
On and off. So you also share such experiences with your students.
Yeah, sometimes.
Okay.
Sometimes we share. Yeah,
Okay.
yeah.
Um, does a student mindset really affect in how they treat the students? Do you counsel them? How, I mean, do you counsel them to how to counsel a patient, how to treat a patient in terms of humanitarian grounds?
Yeah, sometimes generally they're all grown up people. Majority of the students, they know
Mm,
these things, they behave properly.
mm,
Now, when then we come across some student behaving rudely with the patient, not responding to the patient's questions,
mm.
definitely at that situational, we definitely tell them, see, we should not behave like this. See, patients, they come with a lot of problems, and imagine you in that situation, what will you do, isn't it?
Correct. Correct.
So definitely situational, we advise them.
So thank you, sir, for giving us so much time, and then we had a beautiful discussion. Probably we might get connected and then talk more about
Yeah, yeah,
neuroscience and all
yeah,
that.
sure, sure.
It was great pleasure.
Thank you.
Thank
Thank you
you.
so much.
Thank
Thank you.
you.
Thank you.